There's so many different layers of this, like onion. It's unreal.
First Nations leaders in Manitoba have declared a state of emergency due to deteriorating health services in the north. We spoke to a healthcare worker in the Northern Health Region who says the situation is worse than it was at the height of the pandemic. The COVID-19 pandemic has exposed many issues within the healthcare system. Staffing shortages has been a major one, and once again, those living in northern Manitoba are shedding light on a serious problem. The region there continues to lack proper health services.
There is zero sign of improvement. Nothing at all.
The healthcare worker we spoke to, who was asked to remain anonymous, used to be a nurse in the Northern Health Region, but due to working conditions, they left nursing but continue to work in healthcare. They tell City News that in addition to low staffing levels, there is widespread burnout, citing the nursing vacancy sits around 70% for the entire region.
We are being forced to provide subpar care in terms of being run ragged. We're trying our best. If they want nurses in Manitoba, things definitely need to change, and they need to make our working environments not as toxic and dire as it is right now.
There's been a state of emergency now for a number of years.
Dr. Barry Lavallee says First Nations leaders in the north are seeking more control over the health systems that are meant to serve them, but right now they don't have a voice.
This is a racial issue for First Nations in a system that's dominated by non-Indigenous people who treat us poorly, and there are consequences to our health.
Lavallee says wait times in northern nursing stations have increased drastically, and First Nations leaders, including himself, have solutions to the issue, but the federal and provincial partners will not listen to them.
We are dying unnecessarily because this healthcare system is not meeting our needs.
The healthcare worker we spoke to says the health system will only continue to worsen if action is not taken soon.
If we're constantly working short and we can't run a full clinic in these nursing stations or wherever, then how can you monitor these chronic issues if you're only seeing emergencies?
In Winnipeg, Alex, Karpa City News.